Okay, today I'm going to be talking to you about anxiety and what it's like living with anxiety. Um, Me, myself, also, I have anxiety. So just imagine standing in front of a crowd, your heart racing, your palms sweating, and your mind goes blank. This is how anxiety attacks people on a daily basis. So we're here to see what we can do to help people with anxiety. Anxiety goes way back to the 1600s, and they gave it the name melancholia, which scholars gave. Anxiety was described as a mental health condition. Scholars say these conditions came from genetics or a chemical imbalance, and it wasn't until the 20th century when Sigmund Freud and John Watson came up with the ideal to talk about it to deal with anxiety. How anxiety impacts people's everyday living. Anxiety stems from traumatic events or intense fears. Um, it can mess with your careers, your hobbies, your everyday living, your socializing. Some things that people need to stay away from when they're dealing with anxiety is caffeine, alcohol, nicotine, anything that will uh, basically make your adrenaline flow and affect you to where your heart is racing because sometimes that happens to me. Some of the treatments of anxiety is medication, therapy, group sessions, and like me, myself, and I'm on medication and I do therapy. Here are some pictures of people dealing with anxiety. If you take a few seconds and look at each picture and see if you can tell what they're dealing with, or what they might be thinking, or how it's affecting them in the long run, or stopping them from doing their things. Or so just take a few seconds to look at the pictures. Coping recovery is very important to find strategies and focus points to help control your anxiety. Thinking small to avoid disappointment, asking for help, uh, group sessions, engaging in problem solving. And not everyone will recover from anxiety because reoccurring things like depression or trauma. But finding out what is causing your anxiety will help you get to the root of it and like basically digging your way out um, from anxiety. Conclusion from finding out about the history and the causes, what triggers anxieties, and seeking treatment, we all can look forward to living a healthier and better life. Here are some references that I went through and read and got some of my facts and statements from. If you have time, take a look at them, read them. You might know somebody that has anxiety or dealing with depression or just any kind of mental illness that you think that any of these references or resources might can help them. So thank you and have a good night.